and the implications for public health.
Can employees told to stay away from work be denied pay? We'll speak to an employment law expert and discuss the implications for travel and the economy.
We'll also go to the United States as the race to become the Democratic presidential nominee hots up ahead of Super Tuesday.
And beyond the diagnosis, we hear from the family of a child with an extremely rare disease about what it's like to be the only person in the country living with such an illness. All of that after the news, read now by Kieran Ivrin.
The HSE said that the risk to the general public following confirmation of the first case of COVID-19 here is still low, but this risk may change. Contact tracing of those who may have been in close contact is continuing. It's likely to be completed within about 24 hours or less. Our health correspondent, Fergal Bowers.
The male patient in this first confirmed case of COVID-19 in the Republic of Ireland is being cared for in a Dublin hospital, and infection control measures are in place. He travelled from an affected area in northern Italy, so this is an imported case. Contact tracing is now underway to try and establish who he may have been in close contact with. That is examining all stages of the journey made by the patient. The HSE has said that people who need to be notified will be contacted. The Department of Health said the case was not a surprise and was expected, and it has stressed the importance of people reporting symptoms to the appropriate health services in order to prevent COVID-19 from further spreading. Ireland remains in the containment phase for this new virus.
State television in Iran says 11 more people in the country have died of COVID-19, taking the total to 54. The number of others infected has risen to just under 1,000. In South Korea, where 20 deaths have been reported, the authorities say 9,000 members of a religious sect are showing signs of the illness. If they test positive, it would represent a large increase in the number of infections in the country. So far, there have been more than 3,500 confirmed cases. Half of those are members of the sect. The head of the World Health Organization has warned that fear and panic over the coronavirus could have dangerous political and social consequences, as well as the negative impact already seen in the global economy. Dr. Tedros Adhanom Ghebreyesus was speaking at an international humanitarian forum in the Saudi capital Riyadh. He condemned the stigma that had arisen towards some countries over the virus, saying the world must unite against it. The EU's border protection agency Frontex has said it's on high alert as thousands of migrants seek to enter member states from Turkey. It said it's deploying support to Greece, which has blocked nearly 10,000 people trying to enter illegally over the past 24 hours. Groups have been gathering at the frontier since the authorities in Ankara relaxed restrictions on the movement of refugees. Greek police said at least 500 people had arrived by boat on 3 islands close to the Turkish coast within a few hours this morning. Gardaí say a teenage girl was killed in a single vehicle road crash near Uachtarard in County Galway early today. She was a passenger in a car which struck a wall outside the town shortly after 1 o'clock this morning. And the weather forecast.
RTE Radio 1 weather with ESB Networks. Hanging bunting? Never attached to electricity poles. For emergencies, call 1850 372 999. Stay safe, stay clear.
Generally bright with sunny spells and scattered heavy rain or hail showers this afternoon, especially in western and northern areas, with the odd snow shower locally. A risk of isolated thunderstorms also, highest temperatures 5 to 8 degrees. And there's a warning that westerly winds will continue to reach gale force today on Irish coastal waters from Ross on Point to Mallinhead to Carlingford Lough. Carol.
Thanks, Ciara. And we're going to go straight to our health correspondent, Fergal Bowers, who's joined us here in studio now. Fergal, what details are known about this male patient who is the first confirmed case of COVID-19 in the Republic of Ireland?
Well, details of the case were confirmed last night by the Department of Health just before 9 o'clock, and this is the first confirmed case of COVID-19 diagnosed in the Republic of Ireland. The Department of Health says it's not a surprise and was expected. This is a male patient from the eastern part of the country. I understand the patient is receiving treatment at a Dublin hospital with infection control measures. The patient travelled from an affected area in northern Italy, so this infection relates to him being there, so it's an imported case rather rather than contact with another confirmed case, for example, that we heard about during the week here. The HSE has said the risk to the general public is currently low. That could change, and it has advised people to go about their business as normal, work, school, etc.
And what efforts have been underway to try and trace anyone who may have been in close contact with the patient, and how long will that take?
Well, contact tracing has been underway to see how has he been in close contact with anyone else. This is a job of a large body of public health doctors that have been examining all stages of the journey made by the patient. Officials wouldn't be drawn on whether the male was on the same flight as that woman who was diagnosed with COVID-19 in Northern Ireland on Friday. But the HSE position has been, that people who need to be notified will be contacted. If they need to issue more public information via a public health messages, they will. So, for example, it might come from time to time that health officials will issue public information notices like, could all people who are on the 10 a.m. train, for example, from X to Z, please contact a certain number. I mean, that we might see that happen in certain cases. It hasn't happened yet. Those who are in close contact would usually be notified to self-isolate and would be checked on daily by public health officials. Casual contacts are seen as very low. There are people not in really the immediate vicinity. They're usually given information to phone their GP or emergency department or public health clinic if they have symptoms.
And has there been any criticism of health officials for not giving out more details about cases?
Yes, some members of the public and some media may be unhappy at not getting certain details about confirmed cases and the fine detail of contact tracing. And authorities have to get a balance right here with speedy information, explain the science behind what they're doing, especially with the difference between close and casual contact tracing. But they also have to respect patient confidentiality, as doctors do too, the patient's rights. So the nightmare scenario would be, say, media camped outside the location where a confirmed case is residing or has been living, be it a house or an apartment. I mean, you can imagine what the impact that would have. So the fear amongst health officials is that too much information could identify a patient and lead to people who may be infected not reporting their symptoms to doctors, which could lead to the virus going unreported and underground. And that would be a major problem and could lead to uncontained spread.
Thanks, Fergal Bowers, our health correspondent. We leave it there for now. Justin.
Now we're joined in studio by Dr. Ronan Glynn, Deputy Chief Medical Officer at the Department of Health. Dr. Glynn, you're very welcome and thank you for joining us in studio today. On the specific case identified last night, what can you tell us about that individual, where he came from and how he was identified?
So Justin, we've been very clear from last night that there's very limited information that we're prepared to give out at the moment. We can confirm that it's a male patient, that he resides in the east of the country, and that he has this disease as a result of travel to an affected area, in this case northern Italy. What happens to that person now? So there's as we've been saying for weeks, there are protocols and algorithms in place to deal with all suspect cases, and these have been activated on many occasions over the past number of weeks, and they're being refined as more information about the virus and about the disease becomes available. In this case, we can say that the person self-identified, and all of the normal testing procedures were followed and the protocols were followed, and things are working well. I think it's very important to say that, to reiterate what the World Health Organization has said, is that the key tool for us at this stage of containment is that we have a cooperation from the public, that people know that we want them to put their hands up and tell us if they've got symptoms, to come forward so that we can help them. And so far, that's exactly what is happening, and that will be key in the days ahead as we seek to contain this.
Now, as we heard from Fergal there, it's understood that this man came on a flight into Dublin Airport. Have people who were in close contact with this man all been identified now and contacted?
So you'd appreciate that the process of contact tracing is a complex one. It only started less than 24 hours ago and is ongoing. There is a whole range of risk assessments that underpin that contact tracing process. Public health doctors commenced it last night. It's ongoing, and I'm not in a position to give any more detail than that. But what I can say is that the people, in the first instance, the doctors who need to have this information, and they will be contacting the contacts who need to have more information. We are constantly striking a balance And we have been open and transparent throughout this process about the developing situation internationally, our preparedness here, and we will continue to give more information as the situation evolves. But we have got to at all times protect the confidentiality of individual patients.
Sure, but for the other people who for somebody who might have been on a flight from one of the affected areas into this country and who now might be concerned, given the development that we've had last night with this case, can you reassure those people that they will be contacted if they were on that flight?
I can absolutely reassure people that if there's a close contact of any case, so I'm speaking in general terms here, if any case is identified as having been on a flight, the close contacts of that person will be contacted and given appropriate advice. For anyone who's concerned, whether they've been on a flight, whether they've come back from an affected region, or whether it's someone who hasn't travelled at all and just wants more information, I would urge everyone to go to hse.ie. It's updated daily. It gives the latest advice, both in relation to Ireland and what's happening internationally, and people should follow that as the key source of information.
And does what you're saying in relation to close contacts and making contact with those people and providing them with information, does that also apply to people who might have been on public transport outside of an aeroplane, if they may have also been in contact with this individual or any other individual who's suspected of having the disease?
So from the perspective of contact tracing is something that infectious disease and public health doctors engage in on an ongoing basis for years and years for a whole range of infectious diseases, and indeed for many diseases that are far more infectious than COVID-19. Measles, for example, is an extremely infectious disease, and in the past, if necessary, we will, as Fergal said, we will issue a public notice where that's necessary. If we're not confident that we can contact close contacts in another way, we will take the appropriate steps at the appropriate time. But at this moment, in relation to this case, contact tracing is going on.
Okay. Now, does this specific case change any of the advice or the arrangements that have been put in place for the public?
Not at all. The ECDC, the European Centre for Disease Prevention and Control, has been clear that the situation that we've seen evolve in Italy, there is a moderate to high likelihood that will occur in other countries such as Ireland. We are preparing for that, but that notwithstanding, we still remain in a containment phase here. We've had one case. There is no evidence of community transmission so far in Ireland. It won't be surprising if we have more cases, but the confirmation of the case here and the case in Northern Ireland in the past number of days does not change our risk status and does not change our approach.
Have you projected forward how many potential cases we might expect to have in this country in the coming weeks?
So again, one of the key challenges with this virus is that it's a novel virus. We only have about 8 weeks worth of scientific information, and whilst the level of information and knowledge about this virus has developed probably faster than in relation to any pathogen in human history, there is still a lot that is unknown. So there's modelling work going on both in Ireland and across the world that will help us to understand the dynamics of this virus and how it's likely to evolve over the coming weeks and months. And that is happening here in Ireland at the moment. But that's an ongoing process and changes as we get more information.
How many tests have you carried out to date on people?
So we provide a weekly update on the number of tests that have been carried out to date. So and we provide that every Tuesday night for tests that have been provided up to close of business on the Monday evening. So as of last Monday evening, 90 tests had been carried out, and we'll be updating the public on that again on Tuesday night.
And are you increasing the number of tests that you have that you expect to be carrying out?
So it won't be surprising if the number of tests has increased significantly when we release that figure next Tuesday, given that we expanded the case definition to include a whole range of affected regions early last week. But what I can say is that our laboratory capacity is more than capable for managing the number of tests that are required at the moment. Okay,
and in relation then to the protocol, I suppose, for assessing who is tested and who isn't, I mean, are all of the people who are being tested at the moment, are these all people who would have travelled into the country from an affected area?
Not necessarily. So the case definition, which is essentially the basis of our protocols, identifies two types of people that we need to consider when we're considering testing. So one is anyone who's come from an affected region that has symptoms, And the second is anyone that's come from anywhere in the world who's had contact with a confirmed case. So if you've had contact with a confirmed case, regardless of where that's been in the world, or if you've come from one of the specific affected regions and you have symptoms, then you should isolate yourself and contact the health services. I would reiterate again that the risk to an individual in Ireland at the moment remains low. People should not panic, but they should certainly appraise themselves of the measures that they themselves can take to protect themselves. And first and foremost, that's about following the correct information and using basic hand hygiene and taking those measures regularly and appropriately.
And just in general terms around the testing criteria, I mean, how does testing actually happen? Can a person be tested at home, or do they have to come into a hospital? And how does that process actually happen?
So as I said, as more information becomes available, we're updating the protocols and procedures all of the time. But at present, if someone needs to be tested, yes, they come into a hospital setting to be tested.
Okay. Now, if we see an escalation in the number of cases of this virus in this country, I mean, is it possible that you might have to look at things like closing schools, things like that, which have happened in other countries?
So it's possible that measures like that will need to be taken, and we'll need to continue to monitor the situation clearly as it evolves. But again, I'd reiterate that at the moment we're in containment phase. That's not something we envisage in the near future. But obviously we're monitoring developments, and if measures like that need to be taken, they will be taken, and the reasoning behind those measures will be communicated to the public.
Have you and your team made any decision on whether large public gatherings such as the St. Patrick's Day parades should go ahead?
So we committed publicly last week that the criteria for gatherings would be communicated publicly. Our team is working on that as we speak, and there'll be more information on that coming out over the coming days. Okay,
so you expect to have a decision for those people who are organising those parades in the coming days?
What we want to provide people with in the first instance is a set of criteria that they themselves can use to risk assess and to help them in decision making around their events. But clearly there will be events of major or national significance that will require input from public health doctors and medical expertise. And yes, there will be a process in place around that within the coming days.
What about individuals? Is there an increased risk of getting this virus if you do attend a large public gathering with lots of other people? So
there is no community transmission of this virus in Ireland at present. The only case that we've had that we're managing at present is someone who's come from an affected region. So as things stand, no, there is no increased risk. But again, that's something that we need to continue to monitor.
Okay, and I mean, we've heard people suggest that perhaps we should be restricting visitors into the country who are coming from places where there are outbreaks or countries where there are outbreaks. What's your view on that?
We live in a globalised world. People will travel where they want to travel. As I said earlier, the key weapon that we have here, or the key piece of our armoury, is that people, regardless of where they're from, regardless of their nationality, if they're in this country and they have symptoms, we want them to self-identify, and that will continue to be the approach that we take.
Okay, just one final question around airport screening. I mean, does the World Health Organization's upscaling of the threat level from high to very high, does that affect our approach to screening? And is there a case to be made for taking people's temperature on arrival at the airport?
So this has been looked at extensively internationally over the past 20 years. The World Health Organization is very clear that entry screening, temperature screening at airports, there is not an evidence base behind it. It does not work, and it has many unintended consequences. People can conceal a fever very easily by taking paracetamol. It involves an enormous diversion of public health resources to airports to do it, and those resources are needed to undertake far more evidence-based measures, such as the contact tracing that's going on as we speak.
Okay, Dr. Ronan Glynn, Deputy Chief Medical Officer at the Department of Health, thank you for coming in to us today. Now, What extra precautions are the public taking to stay healthy amidst all of this? Well, Carol Coleman has been out and about in Dublin this morning to get people's views.
Not at the moment taking any extra precautions because I feel that it's way too early in the process to be deciding what the actual circumstances are and so on.
So yeah, I think just everybody should be careful. Simple things should be put across, like sneezing into your elbow, and just take normal, natural precautions.
How about yourself?
No, I don't know. I'm not taking any precautions, no. I'm that type of person.
But how about washing hands or stuff like that?
I do that, yeah. I have to have that, yeah.
And in church, would you shake hands with someone?
No, I wouldn't know.
Not
I never agreed with the practice.
It is noticeable from the reports that, a number of doctors have died, and it is also noticeable in certain countries like Italy that healthcare staff have been badly affected, yeah. So, yeah, I'll be extra careful when it does appear in work, yeah.
Are you a doctor yourself?
I am.
No, I'm not, but I was speaking to a friend last night and she has stocked up on food and gone to the shops and stuff, and it hasn't actually crossed my mind at the moment yet, but I think other people are.
Do you think the authorities are giving people enough information about the movements of those who have the virus?
I feel they should keep it on quiet and low key, because I think people get very nervous about it and then they'll overreact to something that we can handle if we keep it actively dealing with it, but keep it nice and quiet and low key.
Okay, so publicising where the person went or what train they were on or that you would not agree with?
No, I wouldn't. No, I don't think it's the best idea.
Do you think that's the right approach to take?
No, I think you should probably tell people.
I don't know. I don't think they should be scaremongering. Like, they seem to be taking it seriously. I don't think it's something that you should overreact about either.
I'll be careful and I'll follow whatever the guidelines and instructions are. But to be quite honest, despite the fact that it's been repeated on all forms of media, be they social or physical or whatever, I haven't really absorbed what we're supposed to be doing.
Those are some people speaking to Carol this morning in Dublin. Now I'm joined by a panel of experts who are here to deal with some of the other questions which are being raised in relation to the coronavirus outbreak. With me in studio is Dr. Pádraig McGarry, GP based in Longford and President of the Irish Medical Organisation. And on the line is Professor of Microbiology at Trinity College in Dublin, Dr. Kim Roberts. And we're also joined on the phone by Dr. Margaret Ann Harris from the World Health Organization. Dr. Pádraig McGarry in studio, I'll come to you first. GPs are the first port of call. What has your clinical practice been like this week in the wake of, I suppose, the increased awareness around coronavirus?
Well, I suppose there's been widespread exposure at this point in time from news feeds in relation to this. There has been an increased information sought from patients on this regard, especially since it came in from northern Italy. I suppose when it was in China it was that bit distance, but since it came in from northern Italy there has been an increase, but not inordinate. It has people ringing up inquiring as to what their risk is, and we have been able to give them appropriate advice. We have been given information all along from the HSE in relation to protocols and algorithms to follow, and that's what we've been doing, and we've been providing the advice to patients in that regard.
One of the difficulties, though, is that there are, I suppose, for people who don't get their news or their information from you, a trusted source, or from, I suppose, media like ourselves or the newspapers, and they're getting their information from social media, that there can be some myths around. Is that a problem that you are experiencing at all?
I think it is a real risk, especially with younger people who do not take their news from usual media. And I think there has to be an emphasis on the media, the medias which the younger people use at this point to get across the interaction with them and get the message across. Because if they don't interact with traditional media, you're not going to get that message. And I think there should be an emphasis in that regard.
And what is the message? What advice are you giving to your patients who might have questions about their own symptoms in relation to what they should or should not do now?
Firstly, if you do have symptoms, you don't turn up to either GP surgery or an out of hours or an A&E. You phone in advance. If you have symptoms, you'll be asked certain questions, and if you fit certain criteria, you will be advised on whatever the appropriate route is appropriate. Happily to date, I haven't come across anybody who's needed to get further advances, but I know doctors have sent patients on to public health who have then channel them down the appropriate routes.
Okay, and of course, hand washing and hygiene is very important.
Absolutely, simple things that people can do. I think most people will clear this virus themselves. The real problem are people who are the at-risk groups, and I think we have to try and contain that by doing simple measures such as hand washing and using appropriate tissues, and that will protect the vulnerable groups in society. Most people will clear it themselves.
Okay, I want to bring in Dr. Margaret Ann Harris from the World Health Organization. The WHO has raised its risk assessment from high to very high. What does that actually mean, Dr. Margaret Ann Harris?
Good afternoon, and thank you for inviting me. What that means is expect to see it in your community, and that we are now asking every country, but all authorities, people like the very interesting and excellent participants on your panel, to have not just a plan, but know what they're going to do in the next days and weeks to protect the population and to look after the people who may fall ill.
And according to the European Centre for Disease Prevention and Control, there are now an increasing number of cases being seen worldwide without a defined chain of transmission. I suppose, in other words, it means it's not possible to say how they got the virus. Is that a cause of concern?
Yes, that is. I mean, we talk about an epilink whenever we find somebody who's got a new confirmed case of an infectious disease that's causing an outbreak. You want to know where they got it from and how they got it from, because then you've got a clear view. You've got your eyes on the chain of transmission. You know where that virus is and where it's likely to go. Once you don't have those clear links between people, once you don't have clear idea of how they got it, then it is much more difficult to track a virus.
Does the fact that your risk assessment has been raised, does that change anything about how the authorities here in Ireland should be responding?
What it changes is from get ready to be ready now, essentially. So if you were thinking about how you were going to manage your health services, how many doctors and nurses and allied professionals you would need, now you have to actually know where they are and how you're going to bring them in and where you're going to isolate people and how many ventilator beds you've got and also who are your vulnerable people. How are you going to get the messages out to them? How are you going to give them the means of contacting you if they think that they have this illness? All those things have to be ready now.
Yes, we've seen a spike in cases in China today. It has 573 new cases. Is the World Health Organization still confident that this disease can be contained?
We've certainly seen China, with its huge population, bring down the numbers. Of course, we don't like to see the daily numbers increase. But again, with an outbreak, you will see sort of peaks and troughs, because remember, each person who gets ill was infected, say, 5 to 7 days ago, or 12 days ago. So what we see now is in a sense a reflection of past history. But we do feel that what China did really, really, really slowed things down, showed that you can contain it, and also gave the rest of the world a bit of time to get ready. Okay,
Dr. Margaret Ann Harris from the World Health Organization. I'm going to let you go, and thank you for joining us. I'm going to talk now to Professor of Microbiology at Trinity College Dublin, Dr. Kim Roberts. Professor Roberts, thanks for joining us on the line. What is the difference between this virus, COVID-19, and the flu, the seasonal flu that we would see regularly in this country?
Okay, that's a great question, and it's certainly something that I think a lot of people are getting confused with. So influenza viruses and coronaviruses are completely different families of viruses. So whilst they may generate similar symptoms, especially in the first few days of infection, the actual biology of the viruses is very different, which means how long they survive in the world, outside in the environment, how the viruses transmit from person to person, and the course of a person's infection are actually very, very different.
Who is most at risk then from this virus, and how can it be picked up?
So the data so far suggests that the people most at risk are people over 80. and that a person's risk of severe disease increases with age, going up from about 60 years old.
Okay, and what about younger?
Also,
what about younger people, babies and young toddlers and so on? Are they in the increased risk bracket?
So I would also just add that people who have other health problems, what are called comorbidities, particularly heart disease or respiratory problems, those who are immunocompromised, they are also vulnerable to a more severe infection. You asked about children, and it's still quite early days, but the WHO released a joint report with China where they looked at over 55,000 laboratory confirmed cases. And I think what's quite reassuring for parents is that it was only a very small percentage of those cases were actually children. So just 2.4%.
Okay.
And those cases weren't severe. So it seems to be a much more mild disease in children.
Okay. If I don't show any symptoms, is it possible that I could still be carrying this virus?
The data so far is suggesting that very early in infection, when people are just beginning to show mild symptoms, they can be shedding the virus and transmitting the virus. So we don't have good evidence to say that people who don't have any symptoms, otherwise known as asymptomatic, are shedding the virus. But people who are possibly pre-symptomatic or only just showing very mild symptoms are thought to be able to transmit the virus, yes.
Okay, Professor Roberts, thank you for that. I just want to come back to Pádraig McGarry for a brief word. Are GPs prepared now for what may be coming down the tracks in the coming weeks and months? Have you been given adequate protective clothing to ensure that you can continue working, and do you have the right resources?
Okay, from the outset, I suppose the most important thing is that we have the advice that has been given to us so that we can follow the appropriate protocols for when patients turn up. For the patients who turn up on the actual surgery itself, we have been given protective clothing to isolate that patient and to protect yourself. We have those in place at the moment. Hopefully you can mitigate that by deferring those patients to either to their car, back home, and we make the phone call from there. But the most important thing is to get the message out to patients. Don't actually turn up to the surgery, ring ahead and get your advice, and that way you stop the spread. There are protocols in place. It's a fluid situation. Things will change, and I think what's the most important thing that GPs have to do is keep up to date with the changing situation so that they can work with the HSE expert group who are changing those protocols as things would arise.
Okay, Dr. Pádraig McGarry, GP, Professor Kim Roberts and earlier Dr. Margaret Ann Harris, thank you all for being part of our panel today. We'll discuss the implications for employers and those planning foreign travel after this break.
You're very welcome back to This Week. Well, the global health experts are telling us that the coronavirus isn't going to just disappear in a matter of weeks or maybe even months. Where it circulates in communities, it will continue to be a big public health issue. So do we need to start preparing for months of disruption to business, travel and the wider global economy? Well, to discuss all of this, I'm joined by Samantha McCaughrean, the business editor with the Sunday Independent, Dermot Jewell, director of the Consumers Association of Ireland, Paul Hackett, board member of the Irish Travel Agents Association and CEO of Click and Go online travel company, and from our Limerick studio by Eddie Keane, lecturer in employment law at the University of Limerick. You're all very welcome. Samantha, I'm just going to start with you first. We all saw the global markets took their biggest hit since the financial crisis in the last week. Are we going to see more of this in the coming week?
I certainly expect that there will be more of it. There is, as you say, if you look back over the last 100 years, it's in the top 5. You're talking Great Recession, you're talking September 11th. So I suppose there's uncertainty is the big thing, but there is actually real issues with companies. So it's not just a sentiment issue. It's not just people worrying about what might happen. Some companies are actually having issues with supply chains, particularly in China. The economists up until a couple of weeks ago were thinking it might be a contained issue. So the kind of risk factor and the downside was more limited. Now they're revisiting that, and that's what we're going to see in the next few weeks. What do they think this means for the global economy? Ireland will have to rethink it, and the next government will have to have a very serious think about it as well.
And so far, what are the main sectors that are taking the big hits?
Well, internationally, you have a lot of the big, the likes of Apple, Microsoft. They're highly reliant, their supply chains, on China. But you've also food companies, drinks companies like Diageo, their sales in China. People aren't going out in China, so drinks there are not being bought to the same extent. It's absolutely widespread. Car manufacturers, local to home here, what you're going to see is food companies have switched quite a bit towards the Chinese and Asian market, partly due to Brexit. There's been a real focus on where the alternatives are, and China has been one of them. I think something like 7% of Ireland's food and drink is exported there to China now. Manufacturing hasn't been hit yet, but I know there's certainly companies that are worried about it. It's about 6 to 7 weeks time frame between order and delivery coming from China. So you can imagine if there was a shutdown of factories in January, it may only be now that certain key components aren't there, and then you have a risk of what happens to those manufacturing companies. Do they have to go on half time or shorter time if things become quite serious for them?
Eddie Keane in Limerick, if companies are struggling to get supplies and staff have to be temporarily laid off, what is their entitlement? Will they be paid or not?
In the unfortunate event that a temporary layoff occurs, the current system is that the employee would be available for a job seekers benefit or job seekers allowance from the state. The employer is not actually obliged to pay somebody who is not currently at work for them.
And if somebody, Eddie, gets the virus, they're entitled to sick leave or illness benefit from the state. The whole trickier area is that of self-isolation. Can you just tell me what position people would be in if they decide to self-isolate based on advice that they're hearing?
Yes, it's a really difficult situation because, as you say, it's quite clear if somebody is unfit for work when they have the virus or if they have any other illness, and that they would be certified, and then the sick pay scheme, whether the sick pay would come from the employer or whether it would come from illness benefit from the state, that would kick in. The bigger problem is where somebody is technically fit for work but has been asked to isolate just as a precaution, because the issue becomes there is that the key point is who decides that the employee stays at home. If it is the employer that tells the employee to stay at home, then the situation becomes the employer takes responsibility for the employee being at home and has to pay whatever wages would be appropriate to the employee. However, if it is the employee that decides themselves that they should stay at home, there's no onus on the employer, no statutory onus on the employer to pay the employee in that situation. Now, most of the advice is that the employer should take a broader view of things here, because the employer does owe a duty of care to all employees. So I suppose not encouraging people to stay at home if they're likely to have the virus might not be the best thing for the other employees.
Right, OK. Just now, travel and tourism is a big sector that's been impacted here. Paul Hackett, what effect on the travel industry here so far? You did notice a bit of a dip there during the week.
Yeah, we had a conference call with the other members of the Irish Travel Agents Association board on Friday, and not surprisingly, there was quite a serious drop in trade last week, Wednesday, Thursday, Friday, substantial. But that is somewhat understandable and to be expected. We were in the office yesterday. We're still getting more calls into our support line than to our sales line, which we'd expect. But even last night, there was a healthy level of bookings coming through. I was quite surprised. I'm not saying we're out of the woods yet, but I think we need to keep context here and some perspective. Aer Lingus and Ryanair are operating full services on all of their routes to all destinations.
So what you're saying is Irish people don't tend to panic and they do like to travel. So if they're going to go somewhere, they really want to take that trip.
I think so. And what was happening last week was people were doing what they should do, contacting their travel agent. Travel agents have been through this situation before. We've had SARS, we've had 9/11, foot and mouth, all of that volcanic ash. So the trade is very professional and very experienced in how they can give some advice to people and reassure them as to what they need to do. It's very much a personal decision as to whether you're going to go ahead with travel. But if we're respectful and we're realistic and put the options to people, what we were seeing on the calls last week was that the vast majority of people were still choosing to travel, but based on informed decisions and based on their personal choices.
Now, Dermot Jewell from the Consumers Association, some people will, of course, be fearful of travelling even to some place like another part of Italy that might not have been directly affected. What happens then? Can they get their money back? You said you're surprised at the number who don't have any insurance.
I am surprised, and we are surprised. It's such an important part of travel now, for a variety of reasons, and the fact that so many consumers are not taking out insurance, I think, is reflected significantly in this circumstance, where they're asking a lot of questions about, am I covered? Can I cancel? What do I do? But yet so many do not have insurance. In a nutshell, what they can do and what will happen is, unless, you mentioned Italy, there are 10 or 11 towns that are specified by the HSA as the Department of Foreign Affairs as not being places to go and visit. But that is not to say you cannot go to Italy. So there are no restrictions in place outside of that. So bottom line, if you decide, I have a flight to Italy, I'm not going to go, you have no entitlement to a refund, because there are no extraordinary circumstances that have been put in your way to say you're okay, you can look for a refund or a rerouting. And that's the problem.
What's the best thing you can do then? Should you just maybe rebook and pay the change fee, rebook for a later date?
That's one of the main things to do. And it's interesting to see that, and I'm glad to see the pragmatic approach. It's certainly been taken in the US, where the booking fees are being waived. So they're trying to make this as easy and as reasonable for the consumer, for the passenger. In fairness, that might be a bit of a challenge to the airline, but at least they're moving in and trying to do that.
Samantha McCaughrean, back to you. Now, big employers haven't really had to take any big actions yet, but say if the big tech companies started asking people to maybe work from home, what effect would that have here?
Well, that would be one of the biggest impacts we might see in Dublin here, I think, on the travel front. So it's estimated that Google alone has 45,000 hotel beds a night in the Dublin area. So that's huge numbers. If they decided to say, stay at home, remote working we'll do video conference calling, etc., that could have a very immediate effect. And already some companies like CRH has said it's going to limit travel to essential business travel only. So there are companies already saying that if we saw some of the very, very big employers here decide not to bring people back into Dublin for meetings, etc., that could have a knock-on effect on the hospitality right away.
Eddie Keane, you say that all companies at this stage should be thinking about their contingency plan.
Oh yes, very much so. As Dr. Harris said earlier, it's not about get ready, it's be ready now. And the idea that even under the Safety, Health and Welfare Work Act 2005, all employers must carry out a risk assessment of all potential dangers in the workplace. So that risk assessment is, as I say, an evolving document, and it would be very advisable for employers to work out now exactly what risk is posed, and to start putting the steps in place to how to deal with that, whether it would be making preparations to allow employees to work remotely, or making preparations for to isolate employees or areas at work, and even just like sanitizers and things like that in the workplace, cleaning regimes, to put those measures in place right now, and to take reasonable steps to protect the employees and to try and curb the potential virus spread.
And if you are asked to work at home, the employer has to provide whatever equipment you might need, be it a laptop or otherwise.
Yes, and one of the characteristics of being an employee is that you don't invest in the equipment for the job, usually anyway. So if the employer would be providing the equipment at the workplace, then the employer is also required to provide the equipment wherever the workplace would be.
Paul Hackett, what happens if a traveller goes on their holidays and then they find themselves caught up in a quarantine situation there?
The response is really managed very well by the Department of Foreign Affairs, and it is usually in the context of support from the local government agency. In the case of Tenerife, it's the local Canary Islands government, and the Spanish Tourist Board are involved. So to some extent, the travel trade pass over to the Department of Foreign Affairs, and we take our lead and our direction from them because they have the independent final say on what happens.
And Dermot, if I can ask you, another thing that has arisen in the last few days is there appears to be a lot of scams on the internet purporting to sell people vaccines to cure this and all the rest of it. What should they be looking out for?
Unfortunately, it's a reality of life that every event such as this shows an increase in scams, and there's an opportunity being taken to take as much money as possible. I suppose the quickest answer to this is never automatically respond to them. Never click on reply. If you are interested, go online, but most importantly, if it's a medication, speak to your doctor, somebody you trust and who can advise you honestly and fairly. Certainly don't go purchasing some of these products. But most importantly, I mean, all day, every day, consumers get messages purported to be from banks, insurance companies, telecoms. Again, you know, there will be people offering you insurance and other elements. Don't click on the reply. Do your own work and check your own needs. And certainly, most importantly, key to all of this, I think, is keep an eye to the important websites giving the important up-to-date information. It's the only way consumers, citizens, people, anybody can make an informed choice.
OK, well, thank you all for joining us. Samantha McCaughrean, business editor with the Sunday Independent, Dermot Jewell, director of the Consumers Association of Ireland, Paul Hackett, board member of the Irish Travel Agents Association, and in Limerick, Eddie Keane, lecturer in employment law at the University of Limerick. We'll take a break.